Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Diabetes, eye complications. Introduction. Patients with diabetes are more likely than other people to have eye problems that can lead to blindness. Many of these eye diseases can be prevented or delayed through good diabetes management. When they occur, these diseases can be treated easily if discovered early. This program explains how diabetes affects eyesight and what patients with diabetes can do to prevent these eye problems from happening. How the eye works. Light first hits the cornea of the eye, which allows light to enter the eye through the pupil. The iris controls the amount of light that enters the eye by changing the size of the pupil. As light passes through the pupil, it enters a clear lens like the lens of a camera, which focuses the light onto the back of the eye. The focused light passes through a clear gel called vitreous until it reaches the back of the eye. The back of the eye is known as the retina. The retina changes light signals into electrical signals sent through the optic nerve to the brain, which translates these signals into images we see. This is how the surface of the retina looks when the doctor looks at it through a special instrument. The central part of the retina is known as the macula and is responsible for sharp central vision. The rest of the retina, known as the periphery, is important for peripheral or side vision. Like other parts of the body, the retina needs blood to function adequately. Blood flows to the retina through small blood vessels. Diabetic-retinopathy. Patients with diabetes are more likely to develop eye problems. Insulin-dependent patients are more likely to have eye problems than patients who are not insulin-dependent. Doctors cannot predict who will have eye complications and who will not. Diabetes weakens the body's blood vessels. The blood vessels of the eyes are small. When they become weak, they leak, burst, or become blocked. The weakening of the blood vessels of the eyes is known as diabetic-retinopathy. Retinopathy means disease of the retina. It is the most serious eye condition caused by diabetes. Blood vessels of the retina may leak if they are weak. This can cause swelling in the retina, which in turn can cause loss of vision. Blood vessels in the retina can also get completely clogged and lead to the death of parts of the retina. The part of vision that is lost depends on the location of the clogged blood vessels. To bypass clogged arteries, new arteries start sprouting to bridge the clogged artery. These blood vessels are very weak. They can crowd the retina, then rupture and bleed in it. This sprouting of the blood vessels is also known as proliferation of the blood vessels. When weak blood vessels of the retina rupture, the bleeding can be limited to the retina or it can go into the vitreous. Bleeding in the retina damages the retina and can cause vision loss. Bleeding in the vitreous makes it difficult for light to reach the retina. It causes clouded and blurry vision. When new weak blood vessels grow to bypass blocked vessels, they may also grow into the vitreous. Scar tissue from a damaged retina may also grow into the vitreous. The vitreous may then pull on the retina, causing severe vision loss and possibly blindness. If you have diabetic retinopathy, your doctor may refer to two types of diabetic retinopathy. Non-proliferative retinopathy refers to the problems caused by the leakage of fluid into the retina or by the clogging of the blood vessels. The second term, proliferative retinopathy, refers to the stage when the new blood vessels sprout abnormally, bleed, or rupture. Usually, diabetic retinopathy progresses from non-proliferative retinopathy to proliferative retinopathy. This progression can take a few years.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Treating diabetic retinopathy. The best treatment for retinopathy is prevention. Good control of blood sugar level and blood pressure, healthy eating, and exercising can help prevent or delay retinopathy. Regular checkups with the eye doctor are essential for identifying early signs of retinopathy. Laser surgery is available to slow down the development of proliferative retinopathy. Laser surgery may also prevent further bleeding. When bleeding in the vitreous occurs, eye surgery to remove the vitreous is also available. Other eye problems. Patients with diabetes can have other eye problems such as blurred vision, cataracts, and glaucoma. People with diabetes may have blurry vision when their blood sugar level is out of control. This blurry vision is temporary and disappears after their blood sugar level is back to normal. All people can get cataracts, especially when older. However, patients with diabetes may get cataracts earlier than people without diabetes. Clouding of the lens causes cataracts. The symptom of cataracts is blurred vision. Cataracts can be fixed by minor surgery. Glaucoma is another disease of the eye that is more common in patients with diabetes. Glaucoma occurs when the pressure inside the eye is increased. Its symptom is reduced peripheral vision or side vision. Glaucoma can be treated by medications, usually through eye drops.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. People with diabetes are more likely to develop eye problems such as retinopathy, cataracts, and glaucoma. Prevention through successful management of diabetes helps prevent and delay these eye diseases. Management of diabetes consists of the following: controlling the blood sugar level, eating healthy, exercising, keeping good hygiene, learning about diabetes. When discovered early, these eye problems are easier to treat. For this reason, patients with diabetes should check with their eye doctors regularly. Your doctor may have additional resources regarding diabetic retinopathy and other eye diseases. Thank you for using Explain.